Hello, Seagulls. Well, it has been a little over 2 weeks since classes resumed, and our campus came alive again. When I talk to students, faculty, and staff, I hear the same thing. We are so happy to be back. And our rankings are up. The new U.S. News and World Report rankings are out. We are once again identified as a best value college, and our rankings in several categories are up from last year. Check it out. It goes without saying that we were hoping to be closer to putting the pandemic behind us than we currently are. But we have learned a lot, and we have new tools in our fight against the virus. The vast majority of our students and employees are vaccinated, and those with medical or religious exemptions are testing twice weekly. When someone tests positive or is a close contact of a positive, we begin an in-house contact tracing process to ensure speedy notification and to begin the quarantine or isolation process. We're providing N95 and KN95 face masks to members of our campus community upon request. And now we're offering take-home rapid antigen tests to students and employees who simply desire a test. Of course, we're also still providing the COVID-19 vaccine to anyone who needs it, and we'll offer the booster shot when it's available. These services, paired with the outstanding guidance that we are getting from our public health experts, are what have helped to make SU one of the safest places to be during the entire pandemic. We're also keenly aware of the mental health challenges that our students face, challenges that have only been exacerbated by the pandemic. In addition to filling positions in the counseling center, we are happy to partner with Timely Care, a service that provides mental and physical health services to our students. We want to be open. We are open, and we're very happy to be open. But we'll only continue to be open if we can keep the campus and surrounding communities safe. In our efforts to provide a more normal semester for our students, we're also hosting more on-campus events. This Friday, September 17th, the Office of Diversity and Inclusion recognizes National Hispanic Heritage Month and celebrates the university's multicultural organizations with Culture Fest, scheduled from 4 to 6:30 p.m. in the Wacomico Room. National Hispanic Heritage Month is celebrated each year from September 15th to October 15th, recognizing the history, heritage, and contributions of the ancestors of American citizens who came from Mexico, Spain, the Caribbean, and South and Central America. SU's observance includes a performance by the band Mariachi Aguila during Culture Fest, as well as the Spanish language presentation, Migrant Writings and Hybrid Bodies in the U.S., with Peruvian-American writer Oswaldo Estrada on Thursday, September 30th. September is also Deaf Awareness Month, and SU joins the Maryland Governor's Office of the Deaf and Hard of Hearing to host a town hall on Thursday, September 30th, to examine the policies, laws, and other things affecting those on the Eastern Shore who are deaf or hard of hearing. This is also a great month to visit the new American Sign Language Zone in our Center for Equity, Justice, and Inclusion. If you haven't been to Blackwell Hall recently, go over it. There have been some really great changes over there. It is so exciting to be back on campus. Thank you all for doing your part to help protect the flock. Now I'm going to turn the briefing over to Eli Maudlin, SU's Chief of Staff and our COVID-19 Response Coordinator. Remember, send your questions to stayinformed@salisbury.edu. Eli, take it away.
Thanks, Dr. Wight. We've got just a few questions that have come in so far this morning. The first is about the positivity rate on the dashboard. Why was the percentage so high on Monday? So Mondays, Wednesdays, and Fridays largely are not only makeup days, but days used to test those that are showing symptoms, and we're testing a much smaller number of people on those days. So the percentages are going to be a little bit out of whack. The best thing to do to gauge campus positivity rates is to look at our weekly rate on the dashboard. we're testing a little over 1,000 people on Tuesdays and Thursdays. Mondays, Wednesdays, and Fridays, that number can be under 50, so it's not the best measure. Is there a point at which SU will start conducting surveillance testing of fully vaccinated students, faculty, and staff? So we are still doing surveillance testing of fully vaccinated individuals. That's through the return testing, which will continue through September 30th. That's also through now the take-home test, which people are reporting their results through. And yesterday alone, 215 people picked up those take-home testing kits from the GSU info desk. If you didn't see the email, take-home tests are available by just displaying your Gall card from 8 a.m. to midnight, Monday through Fridays from the info desk. Why can close contacts continue coming to class? So if you're fully vaccinated, but you're identified as a close contact and you're not experiencing symptoms, you are required to come in for a test and to continue to wear a mask, but CDC guidelines and our own public health guidelines do not require you to quarantine as long as you remain symptom-free. Is SU Health Services currently considering people who sit next to each other in class as close contacts? Nurses independently look at each case, and they will make determinations as to who's a close contact based on information that they get from the positive. And of course, vaccination status does play a role in identifying quarantine and isolation protocols. Is there a campus positivity rate or percentage of students that would trigger the online option for instruction? So as the president said earlier, we have a number of tools in our fight against COVID-19, and one of them is our surveillance testing of the unvaccinated as well as the vaccinated population, but that paired with contact tracing and other measures have led us to conclude that campus is a pretty safe environment, and there are a number of factors that go into that. But at this time, I think it's fair to say that the university campus is fairly safe, and we're still not seeing spread in the classroom. And that is through, as the president mentioned, our own in-house contact tracing. Are vaccinated students who test positive or students who test positive that aren't done at SU being recorded? So anyone that tests positive at SU is recorded on the dashboard, vaccinated or unvaccinated. If someone tests positive at home or at a private physician, they are not included in our dashboard, and that's because our dashboard reports directly to the county. So they would be counted in the county where they took the test, or even in Wacomico County if they took their test here. The last question so far is what type of guidance was given to professors regarding dealing with students who have had COVID? So if a student has COVID and tests positive here, they are coded as such in their faculty members' dashboard. If they test positive off-site, they would need to report that to Campus Health in order for it to be appropriately reflected in our system and in their faculty members' roster. Someone else said, what happens with the self-test? How is it reported? So obviously, if they test positive, they will need to report that to Campus Health. If it's a negative test, they would not need to report it in that case. But the self-test is only available to those that are fully vaccinated and not showing any symptoms. It is truly meant to be another over-the-counter option for those that wish to use it. I think those are all the questions for today. So thank you for joining us.